Welcome to COVID-19 Fertility Empowerment Podcast. I'm your host, Pantea Kalhor. Episode 8, Fit for Pregnancy with Dr. Alison Mitzner, medical doctor, pediatrician, family wellness and fitness expert. Please subscribe to my YouTube channel and get notification for new interviews and pre-order my book Naturally Conceived through Amazon. Get pregnant by unleashing your reproduction power. Fitness for pregnancy is a very hot topic these days, especially during this pandemic situation. Everybody is questioning about how we can get fit and how, especially during this pregnancy period or even before pregnancy, how we can stay fit. So today we have Dr. Mitzner, medical doctor, senior director at a major pharmaceutical company, board certified pediatrician and family wellness and fitness expert, writer and mom of two. Welcome to our podcast. And she's talking about the fitness for pregnancy.
Hi, thanks for having me.
Yeah, so and Alison, what are the benefits of exercise for pregnancy? I just want to categorize it before pregnancy and during the pregnancy, how we can still have a fit body.
Sure. So there's so many benefits of working out, right? We know, pregnant or not, the physical benefits, it decreases stress, it makes you have more energy, boosts your mood. So all these things which are so useful are just as useful, if not more, when you're pregnant. And in addition to that, it helps with a lot of the common complaints that soon-to-be moms would have. The muscle aches, constipation, the bloating, the swelling of the feet, all these things fitness is so useful for. And also just building your stamina, and you need the endurance and the strength during the labor and delivery process. So it really is so useful and beneficial.
So let's go back to the question. First, we'll start before pregnancy, before even the conception period, how we can get ready for pregnancy.
I think at any point, fitness is so valuable, right? So you want to make sure you're in the best shape throughout your life. And then if you know you're getting pregnant, and a lot of times it might not be on the top of the list for some parents or soon to be parents because they're focused on other things or getting pregnant. But once you start and you see the benefits of it, it really is a good thing to get into your everyday, even if it's 15, 20 minutes to get moving. You always hear, the hardest part is getting started, right? It's overused quote, but it really is true. Once you get started, you'll see how much better you feel. It sounds counterintuitive too. A lot of times when you're tired, and this is more like even the first trimester or second trimester in pregnancy, you're tired, and working out really gives you that extra boost of energy. So it's just sort of making it an everyday habit to start in your life. It's really important.
So before getting pregnant, let's say you just feel you may be pregnant, do you have some limitation for fitness? Because I know you cannot do all the exercises that you used to do.
And it depends. You really need to discuss that with your OB, as long as you don't overdo it and you can stick to what you've been doing at that point in time. So you don't, and there's always, you want to use caution in that first trimester, right? That comes up a lot if that can cause miscarriage or whatnot. But the truth is, it really is a good thing to work out. And most of the reasons for miscarriage often are maybe advanced maternal age or chronic illnesses or past miscarriage. And it really is beneficial for the reasons we talked about as far as fitness. And there's really been no study or direct link that exercise, although obstetricians, they would advise to really use caution if you're working on, especially if it's new. But it really has a lot of benefits, even in that beginning stage.
Do you have any specific exercise recommendation for during the pregnancy and before pregnancy?
Yeah, so during, and I should have mentioned that even the first trimester. So you had mentioned what to avoid. You don't want to do contact sports, obviously, and the jolting and really high impact, but low impact exercises are best. So walking or biking, elliptical. I did for both my pregnancies. I think that's great. Swimming, really the lower impact exercises are the best. And Pilates, yoga, a lot of moms find very useful, and it's also very relaxing, which they like. Another weightlifting, that's often a question as well. Can you work out and weightlift when you're pregnant? Which absolutely, yes, you can. You want to stick to lower weights or your own body weight. But it is really useful to increase your endurance and your fitness
Mhm.
levels.
What do you do right now for as a family wellness and fitness expert?
For my own fitness, or
Your own fitness and your patient, or I'm saying your clients.
well, now, I mean, we talk about the pandemic a bit. It's really, and I just put out a pandemic parenting guide because, and one section is all around fitness because it's so important now when a lot of us are just stuck at home to keep that momentum going and move because it is a cycle, right? You'll stop working out and you'll get more tired, you'll sleep worse, your mood will be down. Working out actually does, boost our immunity, which is so important now at home. So there's a lot online, and I have this in my guide too. There's a lot now that you can do with your kids or with your family or other people online, fitness programs, Pilates, yoga. A lot of the gyms have online classes. So there's so much you can do yourself or even with your family. I know my kids love joining in with me often if they're up. I try and do my workouts in the morning, but if they wake up, they'll join me or I'll do some family friendly.
Wow.
And it really is helpful. And we as moms and even soon to be moms, they'll be their kids' greatest role model. So instilling these healthy habits and then seeing you work out or even joining in with you as their mom or their parent, they'll learn things and these habits they'll learn early on that they can take into their adult life.
Yeah, it's good to have a like a family exercise together. Yeah.
Now the kids are home, most camps are not open, so there's a lot of time. And I know like on days like today here in New York, it's over 90 degrees. So we'll stay indoors and do things inside. But there's definitely, you have to be creative and a lot of things online that are more creative now, but you can do as a family. And often your kids won't even notice sometimes that they're getting an exercise and they're just having fun or whether it's dancing or what it is.
So what do you suggest for women who are going to conceive during this pandemic situation?
For fitness, well, the same thing. I mean, all the reasons we spoke about, and I think even more so when you're at home, is because of all those benefits that you have when you're moving. Because it does help with stress and lower stress, helps you sleep better, increases your mood, gives you that energy. So all of these things, if you're just at home and not doing them, I think you feel that much worse. But it's just even just that little bit to keep you moving can really, really, really be beneficial. I know I keep saying that, but it makes such a big difference. And overall in their sleep and how you feel. And then the common complaints, I saw that firsthand. My second pregnancy, I had broken my foot. So there was a time, maybe 3 or 4 weeks that I couldn't do anything. And I saw that cycle once you stop working out. I didn't sleep as well. I was more tired. I was not as patient. I was a little more moody because I wasn't sleeping. And then your diet. So it's that cycle. So if you can just do a little bit every day, especially now while stuck at home, would make such a big difference. And soon to be the conceiving moms who you talk about. I mean, there's a lot of stress, as you know, just on that. Forget the pandemic, right? Like of conceiving and keeping a child, or are you going to get pregnant, and all those other stressors. So it just helps that much more.
Yeah, I remember myself. Then I was like five months. I had my baby 5 months in my belly. I started walking more. I was more cautious before 5 months because I had miscarriages before. So, and swimming, you said swimming is okay for women if it's very low and mellow. Yeah, but even for some women who already experience this fertility, they have to go to OB and they diagnose if they can do it or not. Is that right? Because for some women, it's not really recommended to do too much exercise. Right?
And providers typically are cautious of
Good.
pregnant moms, especially if they've miscarried before, for sure, or if they have any of these at-risk factors that may predispose them to be more likely to miscarry. So you do, like I said, although there haven't been studies, and it is a good thing, I agree, most obstetricians would use caution with pregnant women. And then they'll know what prior risks may have been, or any chronic past medical history that you may have had. But you can also introduce it slowly. I mean, you could work if there's any changes in your body or bleeding, spotting, cramping as you exercise. You know your body best, so you would know, and you need to cut back and really discuss any exercise plan with your doctor.
Yes. Okay, do you have anything to add to our podcast, or do you have any program to suggest, or any link, or any website, or anything else to just empower women more?
Sure. Well, I do. Like I said, I have this pandemic guide that just came out. It's great, great tips for all you can do for decreasing the stress and staying calm during the pandemic. And one section does involve fitness. Within there, there's great tips of how you can do workouts at home, not needing any equipment, what you can find in your house to do if you want to use a little weights. And there's some links in there too to some really great exercise routines and a wide variety. So hopefully something everyone listening or takes the guide can find, because there are a lot of options now. So it is really useful. So I said I can share the link to the guide.
Yes, please. Yes.
You, and it's at my website, www.dralison.com. I can share the link with you all.
Yeah. Can you repeat it?
The website? Oh.
Yes.
www.dralisonmitzner.com.
Oh, easy. Your name and .com. Easy.
Dr. Alison Mitzner.
Yes. All right, Alison. Thank you so much to be our guest. I really enjoyed our talk, and hopefully my audience like it. So just wrapping up, fitness help you to be more confident and be more energized during pregnancy, even before pregnancy. But as Dr. Alison said, you have to be very careful if you had miscarriages before, or you are going to some fertility issues. You have to talk to your OB, and you may be more careful to choose your appropriate fitness program. Yes. Okay.
It's great. I mean, all those habits you learn, you'll take into mom life, which for all the same reasons is so helpful. You're right. You know, you're going to have stress. You're going to not have enough sleep. You're going to want to lose baby weight. So all around. It's these healthy habits that just continue on.
Thank you, Dr. Alison. Thank you for being here.
Thanks for having me.
Yeah.